founder and producer of Technical Veterinary Learning Channel, Professor Ahmed Mamdouh Sharif, Professor of Epidemiology and Infectious Diseases, the ex-head of Department of Veterinary Medicine, the ex-vice dean of Faculty of Veterinary Medicine, Bani Suef University, presents today Technical Veterinary Learning Channel. These days, since 10th of October 2023, the occupied Palestine is distracted completely, especially in Gaza Strip, by tons of bombs that come from airstrikes of the occupying soldiers of Zionism. Egypt support Palestine. Egypt support free Palestine from the river to the sea. Palestine, in the name of God, will be free. منذ 10 من أكتوبر هذا العام 2023 تقوم طائرات جيش الاحتلال الصهيوني بدك فلسطين وخصوصا قطاع غزة وإيقاع عشرات الآلاف من القتلى بين الأطفال والنساء والشيوخ والمدنيين العزل. إن مصر تدعم فلسطين. مصر ترتبط بالقضية الفلسطينية ارتباطا وجوديا. مصر تدعم فلسطين حرة مستقلة من النهر إلى البحر. فلسطين بإذن الله دائما حرة. Third part of Lumpy Skin Disease. Laboratory diagnosis for lumpy skin disease. A very important step is taking samples. Biological samples were collected from unopened nodules. Double blood serum samples collected at the beginning of the viremia and after 14 days or 2 weeks from the beginning of the disease. All secretions and excretions of the body have to be collected. For virology, lymph nodes, skin lesions that not opened have to be collected. Antigen detection, affected tissue, the blood, semen, all of them for PCR antigen ELISA. For histopathology, formalin fixed lesions from skin, alimentary tract, respiratory tissue, and lymph nodes. Laboratory tests done for accurate diagnosis of lumpy skin disease. Number 1, viral isolation and identification. Number 2, electron microscopy in combination with history. Number 3, serology cross reactions with other pox viruses may occur. Number 4, histopathology. And number 5, molecular diagnosis. Number 1, lumpy skin disease viral isolation. The nodular contents were grinded with addition of antibiotics and Nizostatin for 2 to 4 hours with the refrigeration at 2 to 4 centigrade before isolation. Isolation of the virus done upon developed chicken embryo to recognize pox lesion. Isolation of the virus done upon calf kidney cell or lamb kidney cells to recognize cytopathic effects as spindle cells within a day post-inoculation. On egg, chorioallantoic membrane pox of both small and large sizes illustrated as read here. We in a teamwork isolate these at the episodic that occur in Egypt at 2006. Detachment of median derby moving kidney cells beginning at the fourth passage, which increase gradually in further 3 successive passages at the 5th, 6th, and 7th passages. Degree of cellular exchanges of median derby moving kidney cells post-viral inoculation. The changes beginning from 30% at 4th stage, 4th week, and ended by 100% of degree of cellular changes at the 7th week. Passive heme agglutination test. We note that positive results are present with precipitation of the blood clearly at the bottom of the ELISA track. Electron micrograph of lumpy skin disease virus particle prepared by conventional negative staining method to see that lumpy skin disease virus take brick-like in shape. Histopathological examination of pathological section of the skin where vacuoles appear here and coalition of the neutrophils appear at the nodules that appear by staining with hematoxylin and leucine. Hydropic degeneration and vesicle formation in the brachial cell layer of the skin. This slide where the black arrow appear the hydropic degeneration. This slide is stained with hematoxylin and leucine with magnification at multiplied by 200. Intracytoplasmic inclusion body appear in the macrophages at the black arrows with magnification multiplied by 1000. Vacuolation, edema accompanied by cellular infiltration and necrosis in the infected cutaneous and subcutaneous area with lumpy skin disease virus. Magnification is multiplied by 200 and this slide is stained by hematoxylin and leucine. Molecular diagnosis of lumpy skin disease. Diagnosis by PCR. This PCR results of agar showing 200 base pair reaction that positive for lumpy skin disease virus, which indicated at the episodic of Egypt 2006 epidemic. Lane 1 is the ladder, lane 2 and lane 3 are those have positive results. Agarose gel electrophoresis showing presence of 390 base pair amplification of peptide 32 gene from selected sample of Bangladesh outbreak where lane M here is 100 base pair DNA ladder lane from 1 to 5 lumpy skin disease virus field sample are positive at 390. Lane BC denoted to positive control and lane NC negative control. This is a picture of molecular phylogenetic analysis of Capripox virus G protein coupled chemokine receptor. Differential diagnosis. Lumpy skin disease have to be differentiated from pseudo lumpy skin disease, bovine herpes mammalitis, dermatophilosis, ringworm, insect or tick bite, render pest. Lumpy skin disease also have to be differentiated from hypoderma bovis infection, photosensitization, bovine papular stomatitis, urticaria, cutaneous tuberculosis, onchocerciasis. Treatment of lumpy skin disease cases. Treatment. Animals generally recover with good nursing care. Antibiotics for secondary infection. Non-steroidal anti-inflammatory drugs. Up to 6 months for severely affected animals to recover fully have to be supplied by the latter treatment. Control of lumpy skin disease. Recommended actions for controlling lumpy skin disease. Number 1, notification to veterinary authorities. Number 2, quarantine to the infected areas or infected animals. Number 3, different steps will be taken according to the epidemiological situation of the area you are in, your region and your country. Free areas or endemic areas has a different recommended actions. Restriction have to be done upon animal movements and importation, especially the wild animals from epidemic areas to free one, except after using of neutralization tests for detection of infected cattle. When outbreak in lumpy skin disease virus area on a small scale, we have to do the following recommended actions. Number 1, quarantine. Number 2, slaughter of both infected and exposed animals. Number 3, clean to partners. Number 4, insect control. Number 5, application of disinfectant. Number 6, ring vaccination. Outbreak in lumpy skin disease free area on large scale, we have to make the following actions. Number 1, quarantine. Number 2, vaccination. Number 3, clean of the barns. Number 4, insect control. Number 5, application of disinfectants. Number 6, consider emergency slaughtering under veterinary control. This is the map of Egypt. During the time from 2012 up to 2023, Egypt make the following recommended actions: quarantine and massive vaccination of all cattle, disinfection of barns or areas that have an infected animal with ether 20%, chloroform, formalin 1%, some detergents, and phenol 2%. Vaccination. Vaccination successful in endemic areas. Vaccination of a herd at the start of an outbreak is of limited use because of most of animals in this area will already be in incubating time, and poor needle hygiene in these circumstances may spread the disease. A battery of 3 molecular tests was able to differentiate infection with the vaccine strain and with a virulent virus was developed. No spreading from vaccinated to non-vaccinated cattle was recorded. Slaughter of affected and in contact animals, destruction of contaminated hides, and vaccination of all animals at risks is common approach when the disease is introduced to a previously free area. Freeze-dried, live attenuated Nithling strain vaccine are commercially available, and the most used confers immunity up to 3 years, and this introduced at later years in Egypt. Sheep and goat pox vaccine is used to confer immunity up to 6 months, and this is used from the year of 2021 as a part of Egyptian vaccination to the cattle and all animals at the risk, but may cause local and severe reaction after injection of the vaccine. This was used in countries previously free of lumpy skin disease virus because it eliminates any risk of escape of attenuated live vaccine virus from vaccinated herds as seen occur with the Nithling virus vaccine. And I prefer this sheep and goat pox vaccine than the Nithling vaccine for vaccination. A small percentage of cattle vaccinated with sheep pox vaccine do develop local granulomatous reaction, but there is no spread of the virus to sheep running with the cattle. Keep on the track for following up the rest two parts of lumpy skin disease and all the infectious diseases on this scientific channel.